Hello, my name is AMJED. I'm a pharmacy student at University College, and this is my friend
MAYTHAM.
Today we will be guiding you through an introduction about asthma. Asthma is one of the most common chronic diseases of the childhood, affecting about 6 million children worldwide. Asthma is a chronic lung disease that can cause repeated cough, wheezing, and breathing difficulty.
During acute asthmatic attack, there is inflammation on the swallowing of the airway lining the lung. Also, there is a mucus production on the spasm of the airway that lead to decrease the airflow.
Asthma is characterized by airway inflammation. The airway lining becomes red, swollen, and narrow. Airway obstruction, the muscles encircling the airway tighten, causing the airway to narrow, making it difficult to get air in and out of the lungs. Airway hyperresponsiveness, the muscles encircling the airway respond more quickly and vigorously to small amounts of allergens and irritants.
Common signs and symptoms of an acute asthma episode include coughing, wheezing may be absent, breathlessness while walking or while at rest, respiratory rate increased, chest tightness, chest or abdominal pain, fatigue, feeling out of breath, agitation, increased pulse rate, inability to participate in sports.
During an acute asthma episode, signs and symptoms of increasing respiratory distress or breathing difficulty include inability to talk in sentences using phrases or only words, retractions, increased use of chest, neck, or abdominal muscles, refusal or lie down. A child may prefer to sit or lean forward in order to make breathing easier. It is important to remember that not everyone with asthma has the same symptoms. Asthma triggers are allergic reactions to environmental allergens such as pollens, molds, dust mites, or animal dander. Also cold and viral respiratory infections and exercise.
Also, change in weather, exposure to cold air or sudden temperature change, irritants such as tobacco, smoke, air pollutant, paints and cleaning agents, strong odors and or perfumes.
Exercise-induced bronchoconstriction, EIB. For some people, asthma symptoms may only occur during exercise. A history of a cough, shortness of breath, chest pain or tightness, wheezing or endurance problems during exercise suggests EIB. Exercise-induced bronchoconstriction is often a marker of inadequate asthma management. Typically, these individuals respond well to anti-inflammatory therapy. However, it is not an excuse for asthmatic patients for not participating in sport or exercise.
Asthma medication. Medication for asthma are characterized into two general classes. Long-term control medications to achieve and maintain control of persistent asthma. Quick relief medication treat acute symptoms and signs of exacerbations.
Long-term control medications taken daily on a long-term basis. Long-term medications achieve and maintain control for persistent asthma. The most effective long-term control medications are those that attenuate the chronic inflammatory aspect of asthma. Examples include inhaled corticosteroids, the most consistently effective long-term control medications. Long-acting bronchodilators, LABA. Those are used in combination with inhaled corticosteroids. Cromolyn and theophylline, used as alternative controller medications, they are not preferred. Leukotriene modifiers, used to alternative control medications. Immunomodulators, omalizumab, modifies the allergic immune response.
Quick relief medication taken as needed, short-acting beta-agonist, SABA, relax airway muscle to give prompt relief of symptoms. Examples include albuterol.
Asthma control. Parents of children with asthma should be taught to recognize symptoms that indicate poor asthma control and the need for additional therapy. Symptoms indicating poor control include daytime asthma symptoms, wheezing, cough, chest tightness, or shortness of breath. Waking up during the night due to asthma symptoms. Frequently using short-acting beta agonist for relief of symptoms. Inability or difficulty performing normal activities, including exercise, because of asthma symptoms.
An asthma action plan includes: number 1, the steps to take for treating acute asthma episodes. Number 2, long-term control, medications when prescribed. Number 3, emergency numbers to call.
118 82nd Avenue. 702 is calling.
When the windpipe's closing up, we could get air. 183.
Children with increased asthma symptoms need attention. Follow the steps prescribed by the child's health care provider in his or her asthma action plan. Here are some other useful tips. Give the child quick relief medications immediately. Quick relief medications are needed to get control of the acute asthma episode. Help the child to sit in a comfortable position. Children may lean forward to assist breathing. Talk calmly to the child. Encourage deep, slow breathing. Measure peak flow and assess symptoms before and after treatment.
Seek emergency care if any of the following are present. Number 1, the child has trouble walking and talking due to shortness of breath. Number 2, the child is struggling to breathe. Number 3, the child's fingernails or lips are turning blue. Number 4, there is no improvement in the child's symptoms within 20 to 30 minutes of taking rescue medication.
At the end, asthma is a chronic disease that cannot be cured, and all medications available nowadays are used to relieve symptoms of asthma.
Therefore, we need your help to educate people about handling acute asthma attacks until hospitalized. This will save many lives. Thank you for listening.